Estamos recorriendo la Universidad de Columbia, donde nos vamos a reunir con varios científicos en el área de la medicina regenerativa. Aquí en el departamento biomédico de ingeniería, que está financiado por la Fundación FU. Y vamos a estar entrevistándonos en primer lugar con la directora de la fundación y la directora de Medicina Regenerativa, la doctora Gordana Bujanovakovic, que es experta en medicina regenerativa y células madre. Dr. Gordana, nice to meet you. Thank you very much for your invitation here to the university to call about your job. When do you think that this kind paradigm of medicine, this kind of medicine, will be for the whole people?
It's problem for children that are born with deformities of the head and face. It's problem for cancer patients that have bone removed, and also for people actually suffering from trauma, so that things are crushed. So bone is an easy tissue, surprisingly, because it has this ability to regenerate. Like you break your arm, it will heal, unless the defect is huge. Okay. So rationale is that, okay, if there is a large defect or large missing piece, then maybe we can just take these cells that have ability to form bone and give them some guidance, putting them on biomaterial, and provide nutrition and stimulation and everything the cells need in a bioreactor system, and then place this into the patient.
But a little introduction.
Sure.
But the biomaterials may be human or not human, the origin of the biomaterial.
Maybe synthetic, but actually biomaterial has to be something that looks like bone. So what they do today is, for example, if this piece is missing, they would go into the body, the surgeons, and take a piece of bone, make damage somewhere else, and then just carve it somehow so that they have something to implant. So this is helpful, but actually then you are doing harm in another area. So our question was like, can we do this without doing that? So we started to build these biomaterials that can support bone growth, bioreactors that we can use to place the biomaterial and put the cells in, and to grow these pieces. And to grow a piece that is patient-specific, we would take a little bit of fat from the patient, isolate stem cells, and we will do imaging, and then using these images, we would make the exact shape of what we grow. So this is this other thing that I meant to show you. So this is the whole thing, but I will show you now. You see, this is our bioreactor, and you see here, so this is clean, no problem.
Okay.
So this is our scaffold for bone, you see.
Yeah.
And this is this piece here. So it would be this.
This piece of the material. Yeah.
And this is for a very specific patient. So there was a CT scan, and then we made a three-dimensional file, and we used this file starting from very large block.
Sorry, how the patient lose the
They could, it could be either disease, so this bone is being wasted, you know, it is going away,
okay.
Or it may be, say, traffic accident, and then the whole joint is crushed.
Okay.
And then we are working on this and many other pieces of the bone, but the principle is the same. This will be very difficult for, say, any of us in the room. Everyone has a different shape, so you need to make it exactly for the patient. And then we also, using the same file, we make this that looks like a mold. You know, it's like a negative for the patient. So all this is...
What material is that?
This is just PDMS, it's just a plastic.
Just okay.
And then this is disposable, you will not use it again.
Okay.
And then you place this into, the other way, yeah.
In this way,
This way. Correct.
This way.
Correct. To solve the puzzle.
I'm a surgeon.
Yeah. And then you put it in, and then you put this in, and then you here. And what we do is actually you have the introduction of the culture medium through these channels. And culture medium would go through this, you see, many channels to the bone.
The channels.
Yeah. And what we get at the end of cultivation is a completely living piece of bone
In how long? In how many times?
It takes a total of 3 weeks. So we
3
can
weeks?
3 weeks. We can make
For a
bone,
bone,
in 3
a
weeks.
new bone?
Yeah. And then we also have a method to put a layer of cartilage on the bone. So you get bone
That's
with
incredible.
cartilage.
That's
Yeah.
incredible.
So this is something that actually may go into application soon because the cells are from the patient. So we are now trying, we have done already animal studies, we are doing more. And if you show that there is no harm, then you can do compassionate surgeries. So for patients that don't have any other choice,
Yeah.
because you cannot harm them.
Doctor, thank you very much.
Thank you.